The Committee of the Whole for the 2013 budget update will please come back to order, and we're pleased to have with us the CEO of the mental health system, Mr. Mark Moran, to present to us regarding mental health. Please proceed.
Good morning, Chairman. Good morning, members of the Council. I want to make clear that I am not yet the head of the mental health system, although I am about to be committed beyond.
I said Metro Hospital.
Yes, I'm sorry.
Mental health. Okay.
But I'm happy to be here to talk about the Metro Health budget. Is this okay?
Microphone, please.
Is that better? Okay, better? All right, so we have a very brief presentation this morning, so let me proceed right through it. First of all, I want to start out by saying thank you for your support for our patients. You see here on the map of Cuyahoga County some of the patients who have helped us with our marketing efforts. They represent about 214,000 Cuyahoga County residents who are Metro Health patients. You also see the 17 Metro Health sites, including Middleburg Heights, which will reopen halfway through the 2013 budget year. So this gives you a sense of where Metro Health, this page that has essentially 5 years of financials, gives you a sense of where we are. First of all, let me say that 2012 is on track. We have a budget that designed to generate $10 million in operating income. We are on track to do that. You can see we have total revenues that will come in around $750 million and expenses around $740. Discharges are up nicely, as our outpatient and emergency visits. Surgeries are up as well, so we've got pretty good growth. 2013, the overall budget for the system will be an $800 million total revenue and designed to deliver $15 million in operating income. Of course, that operating income goes directly into reinvestment in the system. In each of 2011, 12, and 13, we have invested over $40 million in capital expenditures back into the system. That operating income is necessary to make sure that we can continue reinvesting in the system. You'll see that we will have 28,000 discharges, something that we haven't had in many years, over 1 million visits, almost 18,000 surgeries, and we will create almost 2,900 additional constituents for you all. I think it's important to recognize we've had many discussions about the direction of the Metro Health system. I think it's important to see that in moving from 2009 to 2013, total revenue has actually increased from about $700 million to about $800 million, and we've increased revenues $100 million while essentially keeping employee headcount flat to down. So this is a fairly significant increase in the efficiency and in the productivity of the Metro Health system over the last 5 years. The specifics of the Metro Health budget, as far as the County Council is concerned, goes to our $36 million subsidy. Page 3, as you see up on the screen, we'll talk to you about how that subsidy is actually used. We deliver uncompensated care to people who can't pay for their own care. And as you can see from the chart on the left-hand side, the cost of that care has increased from $100 million in 2009 to about $137 million next year. It's a significant increase. We have almost an unbelievable amount of demand for this service. At the same time, what you see is that we our sources of funding for that, which essentially are the county subsidy, which is the foundation of all of our charity care services, Ohio HCAP, which funds care for those who are uninsured, and then margin that we can generate on other parts of Metro Health's business, and which we, as the Metro Health system, contribute to the care of our citizens. Well, what you can see is that the total cost of care has gone up about 37% since 2009. Metro Health's contribution has almost tripled from $27.6 million to about $75 million. So, we continue to push the envelope and how much funding we can do. We are vitally dependent upon the $36 million, and we hope that you'll reconfirm that today. The other important thing to recognize about is that we're very confident that we're about to enter a new funding environment. We have been working now for 18 months to get what's called a Medicaid waiver, an 1115 Medicaid waiver that would allow us to essentially pull elements of the Affordable Care Act up and get them implemented sooner than the 2014 timeframe. We are close to approval on this. Key provisions of that would be that the Medicaid, we've set it so that it will cover up to 30,000 eligible county residents. We're going to start with about 21,000 county residents. Basically, people who today are not covered by Medicaid would be covered by the waiver. The waiver program will be called Metro Health Care Plus. It will cover people under 133% of the federal poverty level, aged 19 to 64. Others are covered by other programs, and both new and established patients. So we will actually be expanding coverage with this program. It is not simply for Metro patients. We will be reaching out to other new patients. This waiver involves a significant expansion of care to patients. We'll be covering mental health much more fully. We'll be covering pharmacy. We'll be covering durable medical equipment. We'll be covering home health care. There's a lot of improved services for people as we get them enrolled on this program. I think it's also noteworthy that Medical Mutual, we bid the third-party administrator and network services contract. Medical Mutual bid to do this at no cost, providing a service worth over $4 million to the county in so doing. So I think it's worthy of the council's recognition about this really fine community service that Medical Mutual has provided. I think it's also important to recognize that the $36 million that you provide to us will be used to provide the match that will pull down an additional $64 million. So the 36 turns into $100 million of care, but it doesn't all go to the Metro Health system. We anticipate that 22% of the total value, $22 million, will actually go to other providers throughout the community. So this, a dollar of subsidy to Metro Health leverages, or 36 million leverages up to 100 million, but it also means that 22 million goes out to other providers throughout the entire community. It's a very significant, has lots of ripple effects. We have created an enrollment process. All the Metro Health people who are here today will tell you that we start every week, Monday morning, 9 o'clock, with a Medicaid waiver meeting. The entire system is focused on this. We will get enrollment up and running as soon as we get approval, we know we can automatically enroll somewhere around 10,000 people right away, which would get them in and covered. And we, as you know, we've talked about in the past, we have a campaign called Access, which is designed to expand our capacity to be able to serve more people. And we've expanded the clinical capacity to make sure we can really serve a lot more patients. We have really gotten to the point where Metro Health's ability to contribute more, the red bar in the chart, we're really straining, and by making that contribution, we are not investing as much as we need to invest in other parts of the system, primarily facilities and technology. And so we are going to be re-looking at our community discount program as we go forward. But the expansion of resources will mean that we are, on the whole, expanding services pretty dramatically over the course of the next year, we believe. TPA is third-party administrator. It's essentially the payment function. And because we have so many, we have a network of durable medical equipment providers, pharmacies, and so forth, we have to have someone who actually pays bills. We're not able to run this system, this program, through the state's Medicaid program because it has some fairly significant differences. And so we had to essentially create our own administrative structure to make sure it would actually work, basically our own insurance program. So the big challenge for Metro Health going forward that is beyond this year's budget and certainly beyond the $36 million, but something that will come to the council, I think, more urgently as we move forward, is that our facilities are fairly dramatically out of date. Most of the campus buildings are beyond their useful life. The towers are 42 years old, beyond their useful life. Most of the office buildings are between 80 and 100 years old. It's a campus that is struggling to do everything that's demanded of it. You see all those volume numbers, 1 million visits, 70% of which are on the main campus. What we find ourselves doing is a lot of emergency repairs. We have 150 roofs, virtually all of them leak. We have many HVAC systems that need to be repaired. Every week is a challenge. And what we're dealing with is a legacy of deferred maintenance, so much so that we really can't catch up. It's time to do a new system. We need a contemporary facility to handle new technology, for the quality and safety of the care, for patient expectations, and energy use is an increasing drag on our system. So the facility is important. You can see in the picture, it's a little bit hard to understand the picture unless you're familiar with our campus, but the long white building is our ambulatory pavilion that sits between West 25th Street and Scranton. And then you see the white buildings and the pink buildings. The white buildings exist, the pink buildings are future, but what's important are the purple or lavender colored buildings, which is a new patient tower and a new women's and children's pavilion, which are the buildings. Also, you see a new power plant. These are buildings that we really need to urgently start working on, both the design, the funding, and the construction. And frankly, Sandy really got our attention because the horizontal rain and the saturated land around us made it very difficult to operate. And when you go look at, luckily we didn't have the situation that they had in New York where they had to evacuate the safety net hospital, but we really need to be, I think, more forward-looking and make sure that we renew this campus as soon as possible. I think you believe as well, that investing in Metro Health helps achieve the county's goals. The county's goals on extensive economic development through the county and effective health services and efficient county government. We have key initiatives that are speaking to each one of those. On the economic development, renewing Main Campus is a $500 million project in and of itself. We're aggressively building out our ambulatory network countywide. We're working to transform urban primary care. We're involved in the redevelopment of the 25th Street corridor. Health services, you've heard me talk about our access program, wellness and disease management programs in our medical home, and the Medicaid waiver I actually think is going to be a groundbreaking program for this community. And then we've also talked to you about Metro Select, and we know that county employees are important patients in our Metro Select program, and this has a chance to substantially reduce the cost of health care in this community. And finally, let me just close with, I passed out to you the Northern Ohio Trauma System annual report, which is hot off the presses. And I think I'd encourage you to take a look at it because it shows some really dramatic improvements in trauma mortality throughout our community as a result of the collaboration with the Cleveland Clinic. And this is something we're very proud of. We've taken the lead on trauma and building the trauma network and installing protocols. And it's, I think that you can see real results from an investment in Metro Health. So thank you very much, Mr. Chairman.
Thank you very much, CEO Moran, for that presentation. And we're going to start the questioning with the chairman of the Health and Human Services Committee, Councilman Brady.
Thank you, Mr. Chairman. I'll be brief today. I wanted to, what's your best guess of when the feds are going to okay your application?
We're planning to get started December 1st, so we think that the week after Thanksgiving they will give us the approval. That's our best guess right now.
Okay. Secondly, when you were talking about the 100 million, including the leveraged money, you said that, I think you said 22 million or about 1/5 doesn't go to Metro, but you go to other entities.
Would go through Metro to other entities.
Metro to other entities.
Yes.
Could you just briefly tell us what those other entities are? So
it would be mental health bureaus that are providing mental health services that go beyond our immediate care. It would be pharmacy. And for example, we have developed a special relationship with Walgreens to make sure 340B drug pricing is available at all the Walgreens throughout Cuyahoga County. It would be durable medical equipment providers in town here. It would be other jobs and family, other family services type agencies. And I will tell you, we have either used the Medical Mutual Network, which is established, or we have gone out to bid for various of these services to create our own backup network. But essentially, we have anyone who is ready to be able to provide these services and willing to provide these services at Medicaid fee-for-service rates, we're going to do business with. So there is, it's an extensive network that makes up that would be the beneficiary of the 22%.
Mr. Chairman, to Mr. Moran, worthy, but who makes how do you get to that number? I mean, who makes that decision? I mean, how did you come to?
How do we get to 22%?
Yeah.
Well,
Yes.
what we did is looked at Medicaid patients and looked at their consumption of healthcare goods. We had a consultant specialist in the development of these waivers, someone that helped California, helped Cook County, helped Arkansas, come in and say, this is what this is what a Medicaid patient normally consumes through the entire healthcare supply chain, and build that budget for us.
So you had one final follow-up. You had same consultant that worked with the state of California? Is that what I understood
Yes.
you to say?
Their name is Optimus, is the name of the company. Yeah.
Okay, thank you.
Councilman Jones is next.
Thank you, Mr. Chairman. Dr. Moran, well, we know 2014 is the year when the healthcare goes fully online, and
Yes, sir.
I think we've seen many other hospitals working to streamline their operations for that coming time. You have completed your master plan for your campus master plan. Can you go into, or are you able at this time to go into what the funding dollar amounts are that you need?
Campus master plan is pretty significant for the purple lavender color. You see the amounts would be somewhere in the $500 million range. There's more detail to be put around that budget, but you know, we do envision that it will take us until, when we get started today, it will take us until 2017 or so to get it built. So I only bring that up to make sure that the group understands that we're moving down this path. I think your question is in part about readiness for 2014. I think by the Medicaid waiver is essentially the 2014 Affordable Care Act, and we are trying to actually pull that forward 13 months with the Medicaid waiver, and we hope to have the Affordable Care Act essentially fully operational at Metro Health by December the 1st. And we've done a lot of the cost restructuring. We have some more to do, and we have some more capability building, get more capacity to be able to serve people. But we're ready to get started right now. We think that looking down the road, though, beyond the operational issues, that will be a 12 to 18 month challenge for us as we expand all of these services. We really do need to raise the $500 million to renew to the main campus. There are other investments that are also necessary, new technology. As I said, we've invested $40 million each year in technology, linear accelerators, imaging equipment, interventional radiology, interventional cardiology labs, to make sure that we're providing state-of-the-art services. So the total bill to keep the system going is actually pretty significant.
You say 2017 was the completion date, or
Well, we hope to have a completion date of 2017, yes.
you have a rough start date?
Well, we completed the master plan in March, and we've taken a break as we worked on the Medicaid waiver and on Middleburg. We're going to start January 1st and look at some of the detailed design. It will take a couple of years to design this new facility and get all the construction assets in place, and then and the funding in place. So I would say think of construction in the 2015, 16, 17 timeframe.
Thank you.
Councilman Rogers is next, followed by Greenspan.
Thank you. Mr. Moran, can you identify how many patients are represented by the $136 million in uncompensated care?
Yes, I can. There's 42,000 and change. 42,186, I believe, is the number.
Once the Medicaid waiver goes in place, what do you see as the financial impact to that 136 million in uncompensated care?
What we are seeing right now is, as we forecast, would be that roughly 10,000 of the 42,000 patients would immediately go into the waiver, and we would be compensated for their care. So we're thinking roughly $20 million $20 million off the 136, 137, 20 million, just by virtue of getting those people covered. The Medicaid waiver program guidelines say that we also have to enroll the FQHC patients, which is an additional 35 patients, and then we have to open spaces for non-metro patients we don't see, so that they can get access to this coverage as well. So, so that would also be off the uncompensated care. The issue will be, you've heard in the debates over the Affordable Care Act, this notion of a woodwork effect, and we have opened up access in the 17 sites. You can see what the growth is in the total uncompensated care. So I think as we see the Medicaid waiver, we'll have to look at what kind of people come out and say, hey, I need care, I need to get the waiver, and we know we'll be capped for at least a little while on what we can take on in the waiver. So I don't know what the woodwork effect will actually add to. If you take the 137 and you take 20 off, and I don't know what gets added back by the woodwork effect. We just don't know what that is.
Gotcha. Do you envision part of that, I guess, savings would go towards your capital program?
We would like to do that. Mm-hmm. The other issue is that we are constantly investing in the development of our physician force, and so we will be making investments to increase the amount of physicians in our urban primary care centers and in our suburban ambulatory care centers. So part of that money will go to build the physician force, to add the nursing and other ancillary staff needed to run the centers. Part of it will go to capital. We've put a lot of money into imaging and labs, clinical labs to take care of people, and then part of it will go into the facility funds. But I think the point that you are making for me is that by tripling our funding of this uncompensated care, we are really not making adequate investments in our facilities, and that's something that we are going to have to correct soon.
Okay. Thank you.
Thank you.
Councilman Greenspan.
Thank you. With the Medicare waiver, is that a one-time application and you're in as long as the federal government offers the program, or do you have to reapply every so many years?
We set it up. We made the application quite some time ago and set it up so that it would be an 18-month waiver. They have allowed us to continue it as an 18-month waiver, and we have agreed with them that if for any reason the Affordable Care Act gets delayed, that we would be able to reapply to extend the waiver to essentially maintain the services until Affordable Care Act is actually implemented.
Okay. And just one other question. Like Councilman Gallagher and I, Councilperson Conley, we're at the Middleburg Heights opening. And I know you've talked about other expansion opportunities like that. What's the status of those plans?
We've made pretty significant investments in both Westlake, in the current sites that we have that are small, but adding space, adding additional providers in Westlake and in Beechwood and Pepper Pike, where we have a couple of, we have 2 sites in each of those places. And our thinking is that it will take us some time to get each of those sites up to the scale where it could actually support a freestanding facility. So we're kind of gradually, working that. We are also working with a couple of other municipalities that have shown an interest, and to see if we could actually get something started throughout the community. So very active. I have certainly not dropped that one, I can assure you.
Great, thank you.
Okay. Anything else? Thank you. Councilman Gallagher.
Mr. Moran, this will probably be the last time you're before us, I would imagine. And I think I'd be remiss if I didn't say that I certainly appreciate you being where you were and what you've done for the hospital. We certainly got off to a little bit of a rough start, but I think in the end you saw that our heart was in the right place, as we know yours is. I appreciate personally from my committee the help that you've given us in the jail. We're going to come back for some more pharmaceutical help, and obviously those are discussions that we'll have with whomever walks into your office. I would imagine that's going to happen soon.
We'll certainly work that to work out what's best for the sheriff and the jail.
Right, and again, as I said, I greatly appreciate that. That got us through a pretty rough time and carried us on to where we're going to be going, and I hope that's in a good place for the prisoners and the sheriff and his folks over there. But if I could ask for your honesty one last time, is are you going to miss us?
Maybe I'll be back, you never know. Thank you very much for those kind words, and thank you all. The council really has been very supportive. The Metro system is one of the most complex organizations I've ever seen in my life, and it's for you all to pick up your governance role and to do it so effectively is it's been a great help. Been challenging every now and then, but a great help to us. So thank you very much.
Thank you very much.
Thank you, Mr. Chairman.
Okay, we now move on to hear the presentation from Director Danahan on behalf of the Adams Board.
That's right. Or just go till we drop.
Good morning, Mr. Chairman, members of the committee, Bill Danahan, representing the Adam Board. And I'm advised that it would probably be very beneficial if I went through these slides as fast as possible, hitting the high points, and then leave time for questions and answers. And I'm trying to figure out how this thing works. There it is. You've asked for the past on the revenue and expenses. They're submitted to you. The two significant parts on there is the elevation of Medicaid, which occurred this past year, and our change to a calendar budget, which we're just finishing off now, and to coincide with the county budget. You've asked for a reflection. How am I doing this now? Okay, I need help. This is not a good beginning. So what? I'm getting instructions. I apologize. Okay, we're going to move from the slide, ladies and gentlemen.
Did you hear that, Bill?
No, I didn't.
That recognizing the need for help is the first step in recovery.
Boy, I do. I'm glad you recognize that, and it is the first step of recovery. So here I am. You've asked for our board staffing levels. I put them down to before the consolidation, the change in consolidation, the changes I made in 2011 up to the current day, and what would be projected for next year. Last year, I came in front of this council and asked for funding for our intakes to keep them open. I'm thankful that you awarded the money and we reopened the intakes, and they are now open. And they are receiving our consumers on a timely basis. We received $750,000 from you and for that effort, and I appreciate it. That was just a one-year benefit. In the meantime, I've won an award from the state called Hotspots that will alleviate that for me coming from the council to ask to carry that on, and having the state taken that responsibility, which is, I believe they should be taking more, but I wanted to point out that they've accepted and taken that responsibility to ensure this coming year our intakes are open. The Medicaid match and the state funding is now in the state. When they removed the Medicaid dollars from the expenditure levels, it was revealed that out of $51 million distributed to the state, Cuyahoga County benefited with just $405,000. With a population of 11%, that yields just about 0.8% to the state. I don't believe it happened last year or in this administration, last administration. I believe it happened over a number of administrations. And we are working with them to bring equity to this dilemma. The next two slides will show you very quickly how outrageously the funding mechanism is for the state in terms of populations. Basically, Cuyahoga County receives 20 cents per person. The state average is $4.20. It's our hope that this changes. Which brings me to the last part of my presentation, and that's what's happened in the last 12 months that have been unforeseen, unplanned issues that have happened as of January 1st of last year. The first and most prominent one was the closing of Bridgeway and the announcement in the last week of March that they were closing April 1st of this year. Looking at the goal is to realizing that we had the responsibility to care for approximately 500 consumers. Our goal was to create a continuity of care and seamless transfer. 400 were Medicaid consumers, 100 were consumers living in residence. To meet the challenge, we set up a transitional team that reached out to the consumers in any way possible, from phone calls to knocking on doors to home visits, setting up a transportation transition hotline, and providing 2 fares for them to come to us and have them reassigned to other providers. During this time period, there was a transition in which we had to become an agency ourselves, and we had to receive state government authority to provide services. In that, we hired the laid-off Bridgeway workers and signed made independent contractors of them, and then had the continuity of care continue so that it wouldn't be missed. Overall, it cost the board a lot of money. And the one-time expenses, there was $186,946 for the independent contracts for the Bridgeway employees to provide continuous service to the consumers. we purchased Roberto Flores' home. It's a home that has 11 beds for the severe mentally ill, a dual diagnosis. And we want to purchase property at West 81st and Franklin for a residential treatment center. We also want to keep our crisis unit. There are about 22 or 23 different properties that Bridgeway owns. One is the large administration building, which is at 83rd in Detroit, and we're hoping that that will sell to somebody in the social service organization. Right next to it is the crisis unit. Behind it is this one I mentioned, 8100 Franklin. And there's a number of individual residency sites, group homes, and the crisis center. So to manage all that, we have ongoing expenses of property maintenance and repairs and insurance, and we're doing that because we have consumers living in these homes right now. And we have to provide the continuity of care. So that brings a very high price tag of $591,555. We did not plan this time last year of expenses that we need and hope you would consider for assisting the Adam Board. Next issue is the Department of Children and Family Services and their team decision-making. This arose out of the task force that was began about 3 years ago and ran for a year to look at children at risk and some of the fundamental issues to improve the systems. And one of the most dramatic points that came out of that was the integration of mental health into the system, and specifically in their team decision makings, where they bring everybody together, the parents, the providers, and everybody, and determine if they're going to keep the child in the home, remove the child, or what's going to happen with the child. Absent at those hearings is a mental health person, because it's not covered by Medicaid. And we've tried for the last 2 years to figure it out. We figured out that we would cover it through non-Medicaid, and we're asking for $120,000 for the caseworkers to attend those hearings on behalf of whoever is representing the hearings and the families to make better and sounder decisions as to the children. Last year, or within the last year, the community-based correction facility opened up. It has 150 beds that are by residents from our county jail to provide services to help relieve the jail population, but more importantly, get the community involved in the rehabilitation and reduce the recidivism. One of the problems is they do not and have not provided mental health. And we know that about 20% of those in prison require mental health treatment. So we're working with Judge Nancy First at the court. We agreed to split costs and try to figure out how to get mental health services in there. They are paying for a psychiatrist and paying for medication. We're paying for a case manager out of Recovery Resources to do the linkage and help set up the person while they're in there and before they leave with mental health services. And finally, but not least, but not last, is the heroin opiate epidemic that is in our county right now. The county medical examiner revealed about a month ago the extraordinary increase in fatalities for prescription drugs. It is now the leading killer above motor vehicle accidents for the first time in history that is killing our citizens. And it's not in the city, just in the city of Cleveland. It is in our suburbs. In the city of Cleveland, the increase was 76% during the last 3 years. In the suburbs, is 176%. The new profile is now a white male between 20 and 30, and a second profile is a white male between 40 and 50. So we're asking that to work with the, why we are working with the task force, that we begin a prevention and education campaign, which is a missing component that works with law enforcement and treatment, and that we're asking for $150,000. So the last page is a total ask of $936,550,000. I realize this is unusual in the middle of the budget. These things were unforeseen. I did not know they would happen. I did not plan them, and we do not have the resources to deal with this on a more effective basis without further curtailing the resources that we already have. Thank you for your time. I'll take any questions you have.
Okay. Thank you for your presentation, and we'll start with Councilman Brady.
Thank you, Mr. Chairman. Mr. Danahan went through very briefly the story of Bridgeway. Is it Bridgeway? Yeah. But, you know, you really got to understand the impact of this. It was late last winter or early in the spring. I don't know when it was, when, you know, it was like suddenly found out because they got a new bookkeeper, is the way I would put it in my vernacular, that they were bust. And it happened overnight. I mean, it was a disaster. And if these folks hadn't been able to step in, I don't know what would have happened. I mean, we talk about over 500 people. It just would have been a real meltdown in our ability to provide service in the county. So I think we have to recognize that. And so I am supportive of them being made whole, stepping in that emergency, which I don't believe anyone else could have done. And I think we have to, you know, so I just want to make that point. Also, on the heroin epidemic that the medical examiner brought to our attention, there's no point in bringing it to our attention and talking about it if we're not gonna do something about it. So you know, it's not something we can talk about and ignore. And that's all.
Councilman Greenspan.
Great, thank you. And Mr. Danahan, you know, I've said this before, there's no greater advocate for your agency than you. And I want to thank your staff for compiling data, which I had requested to look at the two-year comparison between 11 and 12 and where we're heading as far as programs and costs. Last year during the budget process, you brought forward a number of your agencies who had asked, agencies that you support, asked us to restore their funding was the common cry. And then as the discussions were had, it was actually determined not only did the county meet the requirement from the previous year, for the first time in at least 6 years, you did not get a budget cut from the county. The council actually, against the executive's recommendation, offered an extra $1.5 million in 12 and another $750 in 2013 for additional funding. Then we come to find out, just before the levy hits, that you had authorized a 3% raise for all of your employees, excluding yourself, which was not discussed at any of the hearings, which some of us took great offense to. We felt it was inappropriate. I'll speak for myself. I felt it was inappropriate. We heard testimony earlier today that some agencies and the county itself have not offered to its non-bargaining unit employees raises in at least 5 years, which led me to wonder, okay, we understood there are agencies that are having reduction in funding, which means consumers aren't being served. What does that 115 equate to insofar as delivery of service in which agencies? And looking through the analysis, the best I can determine is the AIDS early intervention program was eliminated. Its cost was about $132,000, pretty close to $115,000. It's very challenging and troubling to me that your staff, they're not deserving. We have many employees in the county that are deserving of raises who haven't received them. But accountability was a mandate in this charter and this new form of government. So how is it that you're able to justify, without discussing with this council, obviously you had to have the intention of giving raises when you were before us asking for more money. You actually asked for $25 million, I believe was the original ask. And how do you justify to those consumers who are no longer being treated, as an example in the HIV intervention program, that your staff receive raises but they're no longer receiving services?
Mr. Chairman, Mr. Greenspan, thank you for that question. It began long before this council was created. It began 2 to 3 years before the consolidation. It began when we had two agencies with two different diverse disciplines coming together and people putting into positions where they had to learn the other discipline. And the fact that they were not given a raise at that particular point in time, with the understanding that after time, after the consolidation, we would look at reconsidering that. Given that they had not had a raise in 4.5 years, given that even before I gave them the raise, I reduced our administrative budget by close to $1.2 million, understanding that I would someday have to answer these questions. I ensured that we had money, which at that 3% raise was $104,000, that it was covered by not additional expense. And by the money that I saved out of the administrative budget, that remainder amount I put into services. And the other part is, I don't think our employees are any different than anybody else. It's my understanding that this council has approved a handful of contracts that would give a 5% increase over 3 years, 1%, 2%, 2%, and with step increases. I don't think our employees are any different. In fact, I would probably think myopically that our employees are the best. That's only because I'm part of them. As you state, I didn't receive a raise during that time and just until recently. So given the fact that there were dynamic changes that occurred, they required them to increase the job that they had, no matter whether they came from the Alcohol and Drug Board or Mental Health Board. This was a combined, integrated agency, and they had to learn a new discipline in a new field. And that they were coming on at a time to do this without any extra money. And as a matter of some of the people took a decrease in pay. So that's the first part. Second part is I let folks know that we'll wait till we're out of the consolidation a few years to see what we really need. Third, we have a contract. And I am not adverse to ignoring contracts. As a matter of fact, I take them very seriously. But when I came on with the board, there was a ethic of having a contract every year. Well, I slowed it down to one every 2 years and one every 3 years. And I've taken that viewpoint very seriously. I think if you continue to hold people at the wage that they had 3 or 4 years ago, I don't think that is in the best service of their ultimate performance. And I think somehow, when you have the opportunity to make an increase, I believe that's the appropriate thing to do. And I believe with saving the $1.2 million and reducing our administrative budget spoke to that. I really do. And I think the fact that they earned it by having to learn a brand new field, one side or the other, spoke to that. So I understand that you disagree with me, and I listen to you, and I appreciate your comments, and I don't dismiss them, but I thought you would should know where I stood on the subject. I thought that I agree with you when you award contracts to other employees for 1%, 2%, and 2%. I think that's great. And that's 5% over a 3-year period. Ours is 3% over a 4.5-year period. And I think that's only fair. So I appreciate your comments, and
Well, I think we're speaking of two different things. You're talking about bargaining units, and you're talking about employees that are not, when you're talking about the 5% issue. The question of, as I said, whether these employees deserve it or not, I'd like to assume that everybody did, but you gave indiscriminately raises regardless of any performance appraisals being done, and you're fundamentally saying that all employees are treated equally regardless if they're a stellar employee or employee that's challenged. From a business management standpoint, I would expect you, as the director of an agency, to continuously look for improvements, and I would consider that part of your job responsibilities in doing so, to operate an efficient, effective organization. I find that your lack of disclosure during the budget request process was not appreciated. I think the timing was not good as it related to the levy either. I want to move on to another couple other questions. In your slide, on slide 3, I believe your statement is incorrect, where you talk about the loss of $750,000 from the county. There was no loss of $750,000. You knew during the budget process that in 2013 you were receiving $750,000. If a layperson was to interpret this, it would look as if the county cut your funding, and we did not. That number was stated up front.
Mr. Chairman, Mr. Greenspan, please accept my apology. I'll make sure that in any other communications that we have relative to that you're absolutely correct.
Now, I'm not sure how much you've been following, whether it was in the media, in the paper, or through these hearings, but we're struggling with a $28 million deficit in the Health and Human Service levy for this year. I'm actually inclined to ask that your $750,000 be reduced by the $115,000 as opposed to increasing your funding. Not that I don't believe the agencies that you serve deserve more money, but we're challenged in trying to identify to balance a budget right now that if we don't, and we're on the current path, by 2016, we will not have any reserves left in the Health and Human Service Fund or the PA Fund. So just to give you an kind of a snapshot of where my mind is on this, do you have any other sources of funding other than the county's $34 million?
Yes, we get money from the state.
Is that state funding enough to cover your operations?
Absolutely not.
Okay. Because I'm also inclined to maybe, and not in this budget cycle, but the next budget cycle, as we did with Metro Health and the Veteran Service Commission, condition funding that it goes to the appropriate agencies. So
I don't understand you, sir. I didn't understand you, sir.
Sure. The comment is to condition funding, that the funding the county provides to you must only go to agencies that provide the services. In a similar manner as we condition the Metro Health funding and funding for the flags for the Veterans Memorial Day. Just a mindset, it's not going to happen in this budget cycle, but it might in the next budget cycle.
All right, Mr. Chairman, I must be thick-headed to say, I don't understand you, sir. You're saying that, tell me what that means, sir.
What that means is if we appropriate $34 million, none of that would go towards overhead administration, only to programming. That's why I was asking the question, how much other revenue do you receive to cover your administrative expenses?
Okay.
Just a thought. And
I'm glad you're sharing with me those thoughts.
Sure. I have no further questions.
Okay. Councilman Germana.
Thank you, Mr. Chairman. This 30 billboards and radio internet spots, I don't understand the connection. How is that going to help this heroin epidemic by advertising? I mean, how is that helping?
Mr. Chairman, we've learned some great lessons from the suicide campaign that we have, which is, this is a suicide campaign, only it's directed towards heroin and the opiate epidemic. There are a whole number of misconceptions and misunderstandings and things that people should know. The majority, over 50%, people that get drugs from other people, they get them from their own people, their own family, their own medicine cabinets. These are friends that go into your house on a party and go into your medicine cabinet and get the drugs there. This is a new phenomena of where people are getting drugs. They are getting, when we're finding out on the west side, through the west side, working with the judges and the chiefs of police, that when they put drug boxes in the police stations, they have an extraordinary number of drop-off of people taking the drugs that they don't use anymore and dropping them off. That's one example of how it could work. And the problem is We're getting so many drugs, we don't know how to dispose of it properly without costing a ton of money. And waste collection, I know you could, at the landfill, cost between $35 and $50 a ton. But for this, it costs $1 a pound for disposal. So we know that that the profile is changing. The profile is getting older. We always looked at the young profile, and we still have to look at the young profile and must look at the young profile, but the profile is now getting older. There are those people that have graduated to their 40s and 50s. And we believe that a educational campaign goes a long, long way. I listened to an individual who was an expert in the field of treatment, and she said to me, if you think you do not have enough money for treatment, you will never have enough money for recovery, when she's talking about the essence of not including recovery in the whole program. And talking to a chief of police, their viewpoint is we can't law enforcement this out. We know that in the treatment rooms that recovery is difficult. And incidentally, in the treatment rooms, there used to be 1 or 2 beds for heroin. Now they're taking up 80 to 90% of the beds. So they are flooding the beds there. So it's a modest amount in terms of the amount of money we're paying for law enforcement. It's a modest amount when we talk about how much we're paying for treatment. And it is our hope that if you do this, that the task force will use this wisely, and that if we could save a number of people from making the wrong decision, and then I think that would be the right thing, sir.
Councilman Gallagher.
What statistics do you have that tells us that that program's going to work?
I'm sorry, Councilman.
What do you have that tells me that billboards, RTA buses, and radio spots is going to work? And have you spoken with the sheriff and the medical examiner?
Mr. Chairman, to Councilman Gallagher, we wouldn't do it without them. We're part of the same task force, and we make sure that they're in the same room, the same place, talking about the same strategy. So we work together.
You've talked to them about this program specifically?
I've talked to people in the field about it, the task force.
My question is, have you spoken to the sheriff of Cuyahoga County and the medical examiner of Cuyahoga County regarding this $150,000 request? And where can you show me this works?
I haven't, Mr. Chairman, I haven't talked to them directly. I've talked to people that work for them. They're in the same task force that we're in. And so it's not like it's a brand new discussion and a new idea. I don't know if they know or not. I probably should ask them, but my hope is that they would agree with it. And my sense is that they would, because this is something, prevention is something that is the first to go in terms of funding, and also the least to be respected by those in allocating funding. We already know that. And to make the point, the Department of Drug and Alcohol and their funding put a mandatory amount of 20%, I believe it was 20% for all funding, must go to prevention. And the feds do the same thing. This $150,000 is nowhere anything at 20%. And I'm just pointing out to you the importance that prevention plays, and there are people a lot smarter than me that could give you an example as to how it works.
In 3 weeks, we'll have a safety committee hearing, and the sheriff will be there, and the medical examiner will be there, and I would invite you to be there, and we can have a longer discussion regarding this. And if you could bring the statistical proof that this program is going to work, I would appreciate it.
Thank you.
Any other questions for Director Danahan? Thank you very much.
Thank you very much.
Okay, this brings us to the end of our morning session with the lunch is ready and it's in the back room. And we are close enough to schedule that we don't need to shave the lunch hour, so we're going to resume our afternoon session at 10 minutes past 1 o'clock. Thank you very much for everybody's cooperation.
No, it was about the,
No, I couldn't read it.